just 20 pounds.
I worked in high-risk labor and delivery for 17 years, and in that time, got to see a lot of different birth experiences and different providers. And towards the end there, I saw a few deliveries and I thought, wow, we as providers should do much better, and these moms deserve a whole lot more. And it was that point where I decided I can actually do something about this, and that was when I decided to leave bedside labor and delivery nursing and go get my master's and become a certified nurse midwife. I had one very high risk and complicated pregnancy myself. I spent a lot of time, 9 weeks in the hospital with my first. So got to witness some great nursing care, some not so great care, some things that I want to make sure are available to our patients if they're in that kind of situation. I didn't have a midwife. They weren't offered at the hospital I was at. So just that being there, holding the hand, helping me focus and breathe through those deliveries, those kinds of memories and thoughts certainly do come into play when we are in with another patient wanting to make sure they have that same care and support. The best part is being a part of what is the best day of someone's life. Watching a couple become a family, being able to see that firsthand, seeing these babies and just how much love there is for them already, it's wonderful. It makes it all worth it. So there are 4 midwives in our practice and 1 physician, which allows us with that physician to be able to co-manage higher risk patients that if we were strictly a midwifery practice, we might have some more difficulty managing. So we can see almost everyone, even though midwives typically are known for doing low risk labors and births. Having the setup that we have allows us to keep a lot of these patients that normally we wouldn't be able to. And we offer 24 hours a day, 7 days a week midwifery coverage. So we've got a wonderful team. We all are very confident if we are handing off a patient to the next midwife that they are going to receive the exact same care that we would give them. So it's very comforting and reassuring for us as providers, but also for our patients. There are certain advantages to being able to deliver in a hospital. We understand that when women are seeking midwifery care, often they have looked into home birth or even a birth center, and for some reason, either just concerns of safety or risk factors, they're unable to deliver there. And our goal is to try and help you have the experience that you wanted at home or in a birth center here in the hospital, where we've got the resources and the backup immediately available if needed. I love the atmosphere here at AdventHealth Castle Rock. The nurses have amazing experience. I've worked with some of them at other hospitals before they decided to come here, and I feel like everyone from the NICU, heaven forbid your baby need that, the transition nurses, postpartum, everyone is just, we want to make this the best experience for you and your family. I feel like the hospital as well just really understands what families and moms need. Everything from the one-on-one birth concierge where you go in, you and your partner, you meet with them, you go through, again, I call it your birth wishes, give you a tour of the unit. You are individual, you're a family and you matter to us. We're not cattle calling you through in groups of 30 or 50 where maybe you can peek into a room in the tour. We want you to have all of your questions answered. Those are all really wonderful things that obviously we want you to go home feeling comfortable. I enjoy going home to my family. I have 3 kids. They are working their way out of the house at this point. I think families are just, they're everything. That's why we do it. And cut that out.